Today we're going to be talking about stem cell therapies. Now, patients ask me all the time about stem cells, and there's a lot of misinformation and misunderstanding about what stem cells are and what their potential uses in anti-aging and wellness are. So let's start out with the basics. A stem cell is a cell that can multiply and develop into collagen or bone or other tissues, but it cannot develop into an eye or an ear, for example. Stem cells are actually very, very simple cells, and there are definitely wonderful things that they do, but a lot of what people claim for them in terms of increasing lifespan, etc., is not clinically validated.
People think of it as almost a panacea, like
Yes.
you could have stem cells and it's going to literally regrow an arm or, you know.
And I mean, I have patients come all the time who've been abroad and had stem cells injected intravenously. And they say they feel wonderful and they're renewed. And yes, they may feel.
So some of it may be a placebo effect and we don't know how much of it.
Exactly. Because you cannot say, because this is not a measurable thing.
Right.
How do you measure? Feelings are feelings,
Right.
but science is all about measurement.
But it does have proven record for, I know, for some collagen growth, right? For additional. How do you feel about hair? Does injecting stem cell, can it regrow hair?
Hair is an organ, just like an eye or an ear. Stem cells cannot develop into hair.
Okay.
Now, think about stem cells as the original stem cell would be when
Embryonic, right?
yes, when even before embryo, where sperm meets ovum, those are half a cell each.
Okay.
They become one cell. So that's the original
Stem cells. So they're pluripotent.
They're pluripotent.
They can do.
And that can turn into a baby, and so.
And I know some people are using like their cord blood cells from the cord.
Yes, and that again, we're going to talk about the
where they come from.
Legal sources and illegal sources.
Because I know stem cells got bad rep because people think there's this whole talk about the aborted fetal tissue being used abroad, when whether it's true or not.
Well, that's a separate issue because they do not actually take it from the fetus. So when people say cord blood, what technically they're talking about, not technically, actually, it's got nothing to do with the fetus. So you have the umbilical cord, which attaches from the baby to the mother. And from the fresh umbilical cord, there is something called Wharton's jelly, which surrounds the artery and vein, which go to and come from the baby. Within that Wharton's jelly, there are stem cells. Those stem cells are multipotent.
Which means they can develop in a lot of different tissues.
Ways. They're not like the embryo, obviously, but they can develop into other cells. Now, it is legal in this United States to harvest those stem cells from the umbilical cord. People refer to it as
cord blood. Like
cord
I had
blood.
it done with my children when they were born, my babies, and I have still no idea what I'm paying for. I know
Well,
pay to have it cryopreserved every year.
and there's a whole controversy about all of that. When the theory behind that was to preserve the child's blood so that in the event they had some rare and esoteric disease and they needed blood replaced, then you have the just like marrow transplant.
Mm-hmm.
Most cancers of the blood can now be completely cured. But in some cases, that cure requires that all your existing blood cells are removed from your body and you have fresh uh, blood injected, usually from a matching donor,
Oh, yeah.
usually not from yourself, because your own bone marrow may have been infiltrated with cancer cells. So you will often see drives for people requesting someone from a specific community if you would be willing to see if you're a donor match for someone, let us say, from the
For
Malaysian,
lymphoma.
yeah, from, let's say, they need a donor match, they're more likely to find someone from who came from that part of the world. So very often you will see these drives to get people to come.
So the theory is that in the future they'll be able to use these cord blood cells to cure various diseases of the children, and some of them we may not
Yes,
even know the uses.
that is the theory, but to my knowledge, there is only one recorded incidence of the use of, and there was a big article in the New York Times about the all these banking centers, and
Yeah.
some of them were now sterile, and their fridges had failed, and so a lot of people are not very interested in doing that anymore. But the banking centers have a financial incentive to continue these.
Sure, yeah, yeah. Well, it's only about $100 a year, so I think it's worth taking
Well,
a chance.
$100 a year adds up. If you
That's
have
true.
300,000
People, yeah.
banking their child, so it's a very good business for basically just running fridges.
So in terms of like an adult, how do you extract their stem cells? Because I remember years ago I went to an orthopedist and he said, you know, I had the operation on my knee, had meniscus taken out when I was 13, and he said there's a possibility to maybe regrow some cartilage with stem cells, but you would have to drill into your thigh bone to extract it. And the procedure he described just didn't seem very appealing. It was $10,000, and it just seemed really invasive, and the chances of it improving the cartilage was relatively questionable, right? So I decided not to do it. I'm glad I didn't do it.
So you brought up 2 points there. One, where would be the source?
Yeah.
And the source would be bone marrow. The second question is a separate question, which is that bone marrow cells, which are stem cells, will not turn into cartilage. The alternative is by drilling into the plateau of the bone that there will be some growth. But again, these are not very well documented proof because growing cartilage is inanimate. It does not have a blood supply.
I see.
So it is very difficult to see how stem cells could. But orthopedic surgeons of all specialties have been at the forefront of using stem cells. And this really works. So they can take your fat, and this is all approved by the FDA, and from your fat, they can spin the fat down, and the technical term for it is mesenchymal growth factors. And those can actually be utilized as stem cells, and the place that they work the best, and there's an awful lot of literature on it, is in non-healing fractures. And there are numerous studies to show that fractures, non-healing fractures, of course, are a terrible problem for patients and their surgeons. But it has been documented by CT scans and that you can literally inject these stem cells from fat into a non-healing fracture site, and those cells will form new bone and collagen, and the fracture will heal.
So it's a new fracture. It wouldn't necessarily help something old.
Actually, no, they're old fractures. They're non-healing because usually fractures heal very quickly when the bones are properly positioned and everything. But if something happened where the bones were not properly positioned and the bones did not align and heal, that's what orthopedists call non-healing fracture.
And this is patient's own fat. You can't
it's
take
the
it.
patient's own fat.
Because you hear that a lot, like they say, yeah, I donate my own fat, but you can't take it from someone else. Or
well, this is the thing people have to understand. If you're doing transplants, that is from one person to another, then it has to be very closely cross-matched.
Right.
Otherwise, it will be rejected. Heart transplants, bone marrow transplants, a kidney transplant. These are all complex matching procedures so that the implanted organ is not rejected. There is no magic. And,
so you can't donate your fat to me.
No. But,
it has to be my own fat.
But plastic surgeons are interested in fat because originally when we started using fat, we used it for volume enhancement in the face. So in the process of aging, one of the central aspects which occurs in all patients is descent of the mid-face fat. It is not just skin. Patients come in and they say they want this.
And that was the traditional face.
And that was when it was just a skin-only procedure.
Yeah, that had the similar wind.
Yeah, you had that windswept look because the patient had wanted this, the surgeon delivered this because that's where the incisions were. So as things developed, we realized that the problem with the aging face was not just skin. And the so-called facelift has gone multiple evolutions where we realized that it's not just skin. There's a muscle structure underneath called the SMAS. And if we tighten that and lift that, that will give more longevity to the facelift. But what we really discovered is that you have to replace the volume. If your biggest problem is this has fallen, then you need to replace the volume. And it has gone through an evolution where we started off by using basically fat. You just sucked out the fat from liposuction and you did a fat graft. Now, that is a transplant. You're transplanting the fat from your belly to your face. And so there's no cross-matching problems or anything, and that's related to that. But what happened in facelifting was that that's quite a technically difficult operation to do. And fat is not very vascular, so it does not take.
It dissolves.
It can dissolve, and I remember the very first case I ever did, my chief asked me, have you done fat grafting? And I said, well, I've read about it and I've seen it. And he said, yes, from what I've read, half of it's going to go away. So we should double the amount that we want to end up with, which was standard teaching at that time. And lo and behold, in this case, the fat took entirely. And instead of the patient having a nice smooth contour, she had a huge lump of fat.
Yeah.
And we had to go back and cut it out. And that was the problem with fat grafting. It was entirely unpredictable. And I'll explain to you shortly the reasons why and what we've done. But then after a while, we didn't need fat because the chemists at all these wonderful companies came out with hyaluronic acids.
Which we're going to discuss, I think,
in a separate thing. But we didn't need to be doing that. But now we've gone back to utilizing fat because we've actually figured out how to transfer fat safely.
And that includes stem cells as well.
Yes. So the problem with the original methodology for fat transfer was that we did not process the fat at all. Basically, we just washed it and injected it. But when you think about it, if the fat is too big, it is not going to revascularize. So then we started processes where we would micronize the fat. That is basically make the larger particles into smaller particles. And this is much more successful. So fat grafting is very successful today as long as the surgeon micronizes the fat. And this is where legalities come into this thing. So fat grafting is perfectly legal because the FDA, which governs everything that doctors do, has ruled that as long as it is minimally manipulated, it's okay to re-inject.
So some of it contains then stem cells as well.
But that's what we found out from the orthopedic surgeons. So what has happened very recently is that we have some smaller devices which will micronize the fat into smaller, like millifat, or even smaller than that. And what we realized is that is where the stem cells in the fat are. So now what we will do is in what is called a stem cell facelift. After we've repositioned the face using fat and tightening the skin, we will then subcutaneously inject these tiny, tiny millifat particles, because that's where the stem cells are. And we've learned that they are stem cells, and the FDA has actually approved this because the fat was being minimally manipulated. They do not consider micronizing the fat a major manipulation. Now, stem cells from cord are still approved, but then the question is how many can you get from a cord?
I see, and then you can't multiply them.
The FDA totally prohibits that
Multiplication.
because they are concerned that it could turn cancerous.
I see.
Now, in my opinion, that is not likely, but in the United States, that is absolutely prohibited. So that is why so typically in the United States, you can get 1.5 million stem cells from cord blood because there's a certain limit to how many you can get out of that piece of cord.
Sure.
Now, these restrictions do not apply to countries like Mexico and Panama.
Costa Rica, there's a number of countries.
There's a number of countries. In fact, the United States is considered the best medical practices because we are the most heavily regulated. In countries like Panama and Costa Rica and Mexico, they are allowed to take those stem cells, grow them in culture, and they can multiply them manyfold. From 1 million stem cells, they can grow them to 10, 20, 30,
And I
40.
think they claim you need quite a lot to make a difference, right?
Well, that's the claim.
Yeah.
But I still don't understand the basis of how
And how they can make it through the blood to specific organs and make a difference. And that is a difficult sort of visualization. How would a stem cell know where to go and what to do?
And what to do.
I mean, it makes sense that if you inject it in the face, in the fat, it knows I am currently in the fat, so I'm supposed to generate more fat and so forth. But, or I don't know, if you inject it in the muscle, would it generate muscle?
No.
No, right? So.
And you definitely cannot inject stem cells from fat intravenously.
Mm-hmm.
So patients will come back from abroad and say they had 20 million stem cells injected. And my only response can really be, I'm not sure what they injected into you. I'm not sure how it's supposed to work. But if you feel better, there's no argument with success. I mean, they took a lot of money from you. Usually you go to these countries and they're asking $20,000, $30,000 for the treatments, which is initially simply just lying and having a drip with the stem cells injected into your blood. I mean, it can be done in 15 minutes, literally. And patients are paying for that. But these are patients who have not received satisfaction from the medical system in the United States, and they are looking for something. So, unfortunately, these clinics take advantage and claim that they can cure autism, they can cure muscular dystrophy, and cancer, and these are all claims which are obviously false.
They haven't been substantiated.
Yes, and this is why American medicine is the best, because what we do has undergone rigorous trials and can be proven to work, because the scientific standard is double-blind controlled studies. And even double-blind controlled studies, when one arm of the study is getting a placebo or sugar on, some of those patients will get better. So
the placebo effect is really strong. It can't be underscored.
It cannot be underscored. So sometimes in major studies, you will see that the difference between the active drug or treatment and the inactive drug or treatment, the difference is statistically significant, which allows the FDA to approve that drug because it is statistically significant. But when you look at the actual numbers, it may not be that many, and many patients. So the placebo effect is very real. And I believe that most of these patients who go abroad and claim that they feel great and their life has been renewed and regenerated, you have a great tendency to believe in something if you just paid $20,000 for it. You know?
Well, there's a lot to be said about self-fulfilling prophecies in general, believing in something, and maybe subconsciously even changing the ways you sort of interact in the world. Maybe you work out more, eat healthier. But I guess it's one of those things. There's more to be discovered with stem cells, and how they're going to be manipulated.
As with all things in science,
yeah,
research is continuous, and we will learn more. And what we consider to be true today may not be considered to be true tomorrow.
Exactly. I mean, you hear about these things like fecal transplant, and it seems bizarre, right? Yet, you know, it seems to work for some individuals, right?
Well, there is science behind that, and it sounds bizarre. Yes. But that is a transplant where they are changing the biome of your gut by taking doing a fecal transplant, which is largely bacteria.
Yeah.
So that if your gut problem was caused by bacteria, then having a new set of bacteria, and that's the theory behind probiotics, which is essential in anti-aging, and we'll talk about in one of our other episodes.
The whole gut biome, the importance.
The whole gut biome. So it's we got off topic a little bit, but it's fine.
Because stem cells are still like, I think they're in their infancy, right? There's a lot more
there's a lot more to be discovered
and,
before we can say categorically where they work and where they don't work. But we know from science they are not going to turn into a hair follicle. They are not going to turn into an eye. They're not going to turn into an ear, you know.
But you do use them in your practice for fat.
I use them from fat because I use the fat for volume to give you cheekbones, because you have nice cheekbones, and it's largely fat. I mean, the bone is way back there. And so if you're going to rejuvenate, do facial rejuvenation, you have to replace the fat and give patients those young cheeks.
And where's the best place to take fat from?
Well, the easiest place to take fat from is from the stomach.
So you get like double benefit. You get a liposuction.
A lot of patients love that because they get the liposuction, and then we just don't throw the fat away, we use it. So if a patient is thinking about having liposuction, I always mention the possibility of using them and not throwing them away. And then
but you can't create like large volume. I think you mentioned before, like if for this whole BBL where they tell you they're gonna take the fat from the stomach and create a whole new butt. Now that's probably a little less likely to happen because you need a large volume. Like, is that all that fat gonna take?
Well, that's always been the question. And I see patients who've been to the Dominican Republic, and they come back and they have.
So, in your opinion, how much fat would like an average person retain from transfer?
Well, this is what we've discovered. It depends upon the size of the fat particles.
Mm-hmm.
If you're just sucking out the fat and injecting it back in,
a lot of it's going to die.
A lot of it is going to die. It didn't vascularize.
Which means it needs vessels, blood vessels.
And then it will die, and then patients will get infections.
Or over time, the result will diminish.
Yes.
But if you break it down to smaller particles, they're more likely to develop vessels.
Yes, because living tissue has blood going in and going out. I mean, and if there's...
And then when you talk about vascularization, that's what you mean.
That's what I mean. So if the fats, the lumps of fat are not revascularized. So for instance, when we do skin grafts, they revascularize very easily because the undersurface of the skin has a wide network of vessels. And so skin grafts have a 99% take rate. The take rate of fat, I would venture to guess, when you use large volumes, is less than 50%. And since it's not being processed, you're not putting the stem cells which are in the fat in the correct layers. So that is the problem.
So the key is the right technique.
For fat grafting, the key is the right technique, and fat grafts. I mean, we have stem cells all over our body. Our skin, we call it the basal layer, but it's regenerating all the time. The skin you have today is not the skin you had 90 days ago. So those were stem cells which multiplied and differentiated into skin. So we have stem cells all over our body. It's not as if it's something special or something. Yes, but the claims that are made for it are well beyond what can be justified. So I have a difficult time explaining to patients, and this is why it's good to have a video like this, to be able to, I mean, and here we just talk to the camera, and so just like I would talk to a patient who came into my office and
You're very
asked me my
honest and
stem cells. So this gives me the time to say, yes, if you want to know about stem cells, I have a video on my video cast on YouTube. Go there and you will learn what I think about stem cells at the time when I recorded that video, because things in science change almost all the time. Thank you for watching our video cast on stem cells, and there are many more coming in this series of anti-aging and what can be done and what is proven. But I always come back to this central point, that in terms of anti-aging, what we know for a fact is that if you are near your ideal weight, you're going to live longer. So the single element in anti-aging and wellness is to be at or near your ideal weight. Yes, we're going to talk about other stuff, but ultimately it all comes down to being near your ideal weight. Thank you for joining us today, and hope to see you again soon.